Unfortunately, there is no cure of Parkinson's disease. No any treatment can completely cure of the Parkinson's disease. The medication or the surgery, the aim of them is only to suppress the symptoms of the Parkinson's disease to improve the quality of life of the patient. We are trying to suppress the symptoms of the Parkinson's disease like a shaking or stiffness or movement difficulties to improve the patient's quality of life, to regain their life again. But unfortunately, the disease will continue to progress. Anyway, there is no any other chance. We need to suppress the symptoms as much as we can to support the patient's life, to make them independent, to improve their quality of life. So, in summary, there is no cure, but there is a good option to suppress the symptoms of the motor symptoms of the Parkinson's disease to improve the quality of life of the patients, like a deep brain stimulation surgery, if we can do it in experienced hands with successful surgery. Since the Parkinson's disease is a lifelong disease, even after the successful deep brain stimulation surgery, the patients needs to continue their medication. But we are decreasing the medication at least 50, sometimes 75%. But since the disease is lifelong disease, we need to continue with medication, but much more less than before the surgery. There are two important risks of the surgery. One of them is the infection. Every surgery has some risks. The important point, the surgeon must be enough experienced to manage these risks or to decrease the risks. To manage the infection risk, we are giving antibiotic before the surgery and after the surgery, and since we are doing only this surgery, all of our team members is involved only this surgery, and all of team members are so experienced to pay enough attention for sterility to decrease the infection rate. And we are putting some antibiotic powder inside the wound, and we are taking care, utmost care about the sterility of the surgery, and we are using the most technological devices to decrease the infection rate. Thanks to these techniques, our infection rates are only 1.6%. The second important risk is a bleeding. To prevent the bleeding risk, we are obtaining all MRI images under general anesthesia and contrast enhanced. By this contrast enhanced, we can see all vascular structures of the brain. So when we are going to the target, when we are implanting the electrodes, we are taking utmost care to not touch any vessels when we are going to the target. According to this, we can decrease the bleeding risk like a 1 in 100. Since our patients mostly old, in such group of these patients, mostly we can see the diabetes, cardiac problems, hypertension, such these chronic illnesses. Before to go to the procedure, we are consulting the patients to the cardiologist, anesthesiologist, and internalist to be sure the patients will have the surgery under safe and under best condition of day. So before the surgery, we need to be sure the patients will have the surgery in best way and in safe way. So we cannot say if the patient has a diabetes or other chronic illnesses like a cardiac problems or hypertension cannot be a surgery. No, since most of the patient has such these chronic illnesses, only we need to take care about to manage the complication risk, and then we can take them to the operating theater under full evaluation, and after we sure about everything is ready for the surgery. Since we are implanting 2 electrodes inside the brain and then we are connecting these electrodes to the battery by the cable, yes, we are sending some electrical signals to some part of the brain, but since this voltage is like a millivolts, so low values, you cannot feel any electricity activity inside your brain, and the brain itself hasn't any sensation.